Physicians are increasingly employed by large healthcare organizations. This practice structure is a profound shift from the traditional solo practitioner or small group practice model of years past. Practicing in a large organization creates a number of challenges for physicians which can contribute to physician burnout. The well-being of physicians is critical to the success of healthcare organizations. Physician burnout and satisfaction are associated with patient satisfaction and adherence, the likelihood of physicians making medical errors, professionalism, and physicians' intent to cut their clinical workload or leave their current practice to pursue a new position elsewhere. Although there are a variety of factors that contribute to physician burnout, simplistically, the 5 key drivers include workload, work efficiency, autonomy and control over work, work-life integration, and meaning in work. A variety of factors influence each of these dimensions, including national factors, hospital or organization level characteristics, work unit factors, and individual factors. Although none of these levels is responsible for the entire problem, they all have ownership for at least a part of the challenge and are part of the solution. So what can organizations do to promote well-being in their physicians? One approach is to begin by determining which drivers are the biggest issue for the physicians at your center, and then work collaboratively with physicians to identify approaches to improve that dimension at the organizational, work unit, and individual level. Organizations should also strive to provide an efficient environment and seek to promote flexibility and input into organizational decisions where possible. Organizations should help facilitate work-life integration through appropriate scheduling and coverage for life events. Organizations can also help physicians identify the areas of work that they find the most meaningful and optimize their opportunities to pursue these activities. Studies evaluating practices where physicians are thriving have provided new insights regarding potential strategies to improve the efficiency of the practice environment. A high-level summary of effective strategies to address specific challenges is provided in the table shown here. Organizations can also help cultivate greater meaning in work for their physicians. This process may begin by helping each physician self-calibrate to determine which aspects of work they find most meaningful. Studies have also suggested that regular meetings with colleagues engaged in topics related to mindfulness, reflection, shared experience, and group learning are also constructive and can be an approach to improve meaning and reduce burnout at the organizational level. Successful implementation of nearly all of these strategies is dependent on effective organizational leadership. Leadership has an important effect on physician well-being. One large study suggested that the leadership behaviors of the immediate supervisor, such as the division or department chair or medical director, had a strong impact on individual physicians' well-being. Each 1-point improvement in leadership score on a 60-point scale was associated with a 4% decrease in physician burnout. Similarly, each 1-point improvement in leader score was associated with a 9% improvement in physician satisfaction with their organization. The leadership qualities of physician supervisors also had a large impact on burnout and satisfaction at the work unit level. Approximately 10% of the variation in burnout between work units and nearly 50% of the variation in satisfaction was explained by the leadership score. A collaborative leadership style that engages physicians in identifying problems and empowers them to develop solutions appears to be a key quality for physician leaders. Improving physician well-being has potentially large benefits to the organization. Studies suggest efforts to reduce burnout and improve physician satisfaction result in better safety, reduced malpractice claims, improved organizational health, less turnover, and greater patient satisfaction. I would encourage you to explore the other sections on the resource page which identify strategies organizations and leaders can use to promote well-being and reduce burnout among their physicians. Links to select publications on this topic are also provided.